We're here again with Elliot Seamus from Deltona Counseling. This is for mental health counseling, ethics and counseling class assignment. It's been a pleasure, Elliot, and thank you for allowing me to interview you again.
You're welcome.
During our last interview, you mentioned that you had you experienced a bit of difficulty with a certain particular group.
Mm-hmm.
Without getting into much detail, if you don't mind, what did you find most challenging?
Well, when you have clients who are so far away from where you live, where you function, how you think and feel, there's sometimes too large a gap to bridge, and despite the best intentions, there are people you just can't work profitably with, and so you make sure that you refer them to people who might be more inclined to. You don't leave anyone in the lurch, but I would suspect that most counselors have certain populations that are challenging for them, and well, at least when you work for yourself, you don't have to.
If I remember correctly, there were particular groups that you prefer not to work with?
Mm-hmm. Well, I mentioned the KKK, for an example, and my social and political beliefs are pretty much at the opposite end of that spectrum, and they have a right to be heard and they have a right to help, but that's for me is a gap that I can't comfortably bridge, and I would refer that person to someone else.
You also mentioned that you did not experience much ethical or moral issues. For instance, if one of your clients expressed romantic interest towards you, how would you go about addressing that issue?
Well, I would address it as soon as it came up. I would probably appreciate the gesture or the thought, but I would certainly make it clear that that's not something we could have in a counseling situation, and if that was a challenge for either of us, then I would, of course, have to refer out.
Okay.
Hasn't come up very often.
Okay.
It did once, if you're interested. One evening, a client of mine showed up at my apartment at about 10:30 in the evening, and she wasn't looking for counseling, and it just would have been beyond inappropriate I talked to her for a few minutes, and I sent her home, and that pretty much was the end of the counseling relationship, but that's what needs to be done.
Okay. It'd be interesting to find out what action you would take. For example, we know we can't counsel a family member.
Mm-hmm.
What if there's a family member who insists that you counsel one of their children? How would you go about handling that particular case?
Well, if they were insisting to me, I would probably suggest some help to them, and I would respectfully have to decline. If there's a child who needs a little talking to about something, that certainly wouldn't cross any line, but if there was a need for a regular counseling intervention, then of course I'd have to refer that out. It would help them find someone, but you can't see someone because someone else wants you to, even if they're a relative.
That's true. Well, thank you very much. Again, I appreciate it. Thank you.
You're very welcome.